Good morning. Good morning.
Good morning, sir.
You're welcome to our today's lectures on BDT 152, Basic Dispensing Theory 1. Basic Dispensing Theory 1. Are we together?
Yes, sir.
Okay, we'll continue from where we stopped yesterday. Yesterday we introduced tablets. And I gave us an outline. Yesterday we treated definition of tablets. Then we treated the advantages and what? Disadvantages of tablets. And we went into the types of classifications / types of what? Tablets. We listed the 4 classifications. The tablets ingested orally, tablets for what? Used in what? Oral or buccal cavity. Tablets administered by other routes, and tablets used to prepare solutions. So we continue from where we stopped yesterday. This marker is not writing there. Where is your class rep? Is there no marker here? Huh? No marker here?
Yes.
Wow. Okay, let's continue. So we'll go over to the. Please, can I get my water from you? Please. Fast. Thank you. This one is not. It's not margarine. Drop one in. Thank you. So we continue from where we stopped.
Yes.
We listed 4 classifications. So now let's start with the first one. The first one says tablet ingested orally. So yesterday I told you the difference between tablet ingested orally and tablet used in the what? You can ingest something, it will pass through the oral buccal cavity down to the what? To the what? Stomach, right? Without being used in the what? The mouth. True of us. But the one that is used in the oral cavity, the effect in the what? Oral cavity. Am I communicating? Am I communicating? So their action is local effects in the oral cavity. We have many of them. We'll go into that. So now let's discuss the tablet ingested orally. Under this group we have, number 1, we have compressed tablets. We have multiple compressed tablets. We have repeat action what? Tablets. Then we have delayed release tablets. We have sugar-coated tablets and film-coated tablets. We also have chewable tablets. Now let's take them one after the other. So now, for the compressed tablets, of course, this one is normal one, you know. Am I computing?
Yes, sir.
Basically, just get the granules and do what? Compress to do what? Get the what? Tablet of desired size, shape, and what have you. Of course, we discussed different ways of granulation, right?
Yes.
Yeah, so here are the powders the powders are granulated, the powder mix are granulated to form granules. So the granules are now compressed with compressive force on the punch over the dies to produce what? A tablet of desired size and what? Shape. So that one is normal. So we are here now, we are talking about whether it's coated or uncoated, mainly uncoated, okay? So we can just simply call them what? Our compressed what? Tablets. Most of tablets are compressed. True of us. You can see your paracetamol tablets. It's not compressed.
It's compressed.
It's compressed. So these one are what we call what? Compressed. Nothing additionally what is done on it, just normal compression. Am I communicating? Good. Now, the next group we'll talk about is the multiple compressed what? Tablets. Multiple what? Compressed what? Tablet. There's something about this multiple compressed tablet. They are divided into two. Multiple compressed tablets are divided into two. The first one is layer tablets, and second one is what? Compression coated what? Tablet. Layer tablets. Compression coated tablets. Layer tablets. Compression coated tablets. Now the layer tablets here now they are in what? Layers, okay? It can be 2 layer, 3 what? Layer. It can be 2 layer, 3 layers. Are we together? Are we together?
Yes.
Here the main thing there is that there are sometimes you may see some ingredients. You may have some ingredients that are not what? Compatible. Okay? That are not what? Compatible. And you need them in this formulation, but they are not compatible. Remember what we discussed about compatibility of ingredients. Remember, but you need them. What are you going to do? They are not compatible. You cannot just mix them like that. Okay? Now, what you prepare the thing in what? Layers, separating them. Am I communicating? Separating the what? The incompatible one. But everything is there in one tablet, but they are in layers. So the incompatible ingredient will not mix. At least from the point of production to the point of what? Use. Am I communicating? Because if you mix them, they will just come together, produce something else. True of us. And the integrity of the tablet will destroy. So where you have these ingredients that are not compatible, you prepare them as what? Layered what? Tablets. So as what? Multiple compressed what? Tablets. Are we together?
Yes.
Now that this is generally for multiple compressed tablets. Now when you go into layers, in layered one, they are in layers. They are in layers. I was describing it as if I was talking about layer tablets. I was actually talking about what? Multiple compressed tablets. In general, they are used for what? Incompatible what? Ingredients. Now, but under this multiple compressed tablet, we have the ones that are in layers, and we also have the what? Compression coated tablets. So the one that are layers, that these ingredients are in layer, are aligned in what? Layers in the same what? Tablet. Now we also have the ones that is not in layers. That one, the one we call compression coated tablets. That one you see things like tablet, within tablet, that is within what? Tablet. In the quest to separate this ingredient, you start seeing they prepare it in such a way that you have tablet within tablet and also within tablet. These things are designs to help achieve what you want. Are we together?
Yes, sir.
These things are what? Design. So you have tablets. Sometimes you may just want a tablet that within inside another tablet. Sometimes you have tablet within tablet and it's also within what? Tablet. So this is what you see in what? Compression what? Coated what? Tablet. The idea is to separate this what? Incompatible what? Simple. That is the main purpose. So they can be arranged in layers or tablet within what? Tablet. So this is what happens in what? Multiple compressed tablet. What are the benefits of this? What are the benefits of this? It helps, apart from the helping to take care of incompatibility, it helps in what? Extended release of the what? Drugs. Because they are layers now, they will release small, but two of us, this layer will what? Release, right? Before the next layer will do what? Release. So there's an extension of what? Release time. So there's extended release of drug, yes. Extended release. When we talk about release, we are talking about the drug. That is active ingredient, not the tablet itself, okay? Okay, so now, so it helps in the extended release of the what? Drug. Even, in fact, in general, even in control what? Release. Are we together? Huh?
Yes, sir.
I think I have mentioned, I have already told us that the first advantage, benefit is that it helps to separate this what? So here now, the incompatible materials are incorporated within the same what? Tablet. But they will not react. They will not come together, even though they're incompatible. So these are the science of, this is what we mean by science of dosage form design. So science of dosage form design is called what? Pharmaceutical. This is what we do. Because we know that we need this ingredient, but they will come together, they will react and produce something else if we mix them, just normal mixing. So we have to do what? Arrange them in that way so that you can achieve your what? Purpose. So that's what will happen. What happens in what? Multiple compressed tablets. Okay?
You see that they have to separate incompatibilities. So after they separate, like after separating the incompatibilities, like will they still be like will they still be within the tablet?
Yes, now you see that's the same tablet. It's inside the same tablet. Have you ever seen a tablet that you have? Look as you have different colors.
Yes.
A tablet, even in layers, not even different in layers. Have you seen such a tablet before?
Yes.
Now we have a repeat action tablet under tablet ingested what? Orally. We have repeat action tablets. Repeat action tablets. So what happens in repeat action tablets? What happens in repeat action tablets? Basically, what happened there, the same techniques is employed as a multiple compressed what? As in what? Multiple what? Compressed tablet. But their purpose here is not incompatibility. The purpose here is that the active ingredient now is divided into different parts. The active ingredient is divided into different parts and separated and incorporated in the same what? Tablet, but are in different parts. This part, after this part release, the second part will do what? Release. The other part will do what? Release. Am I communicating? So the action will be repeated over a long what? Period of what? Time. That is the purpose. The same techniques, but not for incompatibility now. This one is that the activity now is divided into different what? Parts. That's what happens in what? Repeat action what? Tablet. So in this tablet, the compression coating technique or sugar coating is used. Of course, now before you can separate the layers, you have to coat. Now, the active ingredients are divided in parts and are coated to release the drug at specific intervals of what? Time. Is it clear now? At specific intervals of time, the different parts will be released at specific intervals of what? Time. So generally, the core tablet is incorporated in coating tablets, and the action is repeated by degradation of the what? Coating tablets. By the degradation of the what? Coating tablets. So they are separated, coated. This one degrade, release, follow the next part, degrade, release, over time, different time what? Interval. So that's where the name came from. Repeat action what? Tablet. Repeat action what? Tablet. Now, after this, both repeat action tablets. There's also an extended release, true of us, but it will over a prolonged time. True of us.
Yes.
Good. Now, we also, the next one is what? Delayed release tablets. This delayed, we have discussed this delayed release what? Tablets. Here, what actually happens here is that on a normal, when drugs enter the what? The GIT, they will do what? The gastric juice, which contain acid, will do what? We facilitate the what? Disintegration, right? And there are some drugs that cannot withstand this acid. There are drugs that cannot withstand this. Not just about disintegration alone. The acid will destroy the what? The drug itself. And secondly, most of them are not even absorbed there. Am I correct? They need it. They people are absorbed at the alkaline medium in the water, beginning of the water, intestine. So what happens is this: they are coated the same science of dosage form design. They are designed in such a way that they are coated. We call it enteric what? Coating. They are coated so that they will pass through the what? The stomach unaffected. On getting to the alkaline medium of the what? Intestine, they will do what? They will disintegrate and what? Perform, release and what? Absorb, and they will go and do their work. Had it been they're not coated, they will be, before they get to the intestine, they will be destroying the what? The stomach. So that's basically what happened in the water. So from there, delay. So you delay the release. That's the meaning. The release is now what? Delayed. So that it will get to the what? Intestine. Does it make sense?
Yes.
So that's what happens in what? Delayed release tablets. Now let me read what I have here. So here the enteric coated tablets are coated with material. Of course, the material they use to coat is one that will resist what? Acidic medium. Listen carefully. Just listen carefully. I've explained. I want to read what I have. Listen carefully. Align what I explained. That is how to study. How to listen to class. I've explained something now. Align what I explain with what I'm reading out now. You appreciate it better. Here, the enteric coated tablets, I mentioned enteric coated, right?
Yes.
Here, the enteric coated tablets are coated with what? Materials that will do what? Will be resistant to the what? Acidic medium of the stomach environment. That's the main thing. Now, because of this now, the drug will not be released where? In the stomach. It will not be, because it won't affect it. But when it gets to the what? The intestine, which is alkaline, it will do what? The drug will do what? It will do what? Will be released. Are we together? So the release has now been what? Delayed until you get to the what? Stomach. Two of us, let's assume that you pack dustbin. Let's assume you pack dustbin, and as you are going out, for those of you that are doing champion of indiscipline, you pack dustbin. As you are going to this place, you wanted to throw it away here. As you are about to throw it away, you now maybe admin came out. You delayed your what? Throwing the two of us and move further. And now do what? Throw it away. You have delayed your what? So that's what happened in the what? The tablet will now, so the release will now be what? Delayed until you get to the what? That's where the name came from. Delayed release. Delayed release what? Tablets. So now, delayed release tablets. Here we have drugs like bisacodil. Bisacodil is like that. Bisacodil is like that. Bisacodil. There are many enteric coated what? Tablets. Let's continue. I'll give you other examples. Okay, now I think I should give you examples as I. Now for the what is it called? For the delayed release tablets, we have here enteric coated tablets. We have here naproxen. Naproxen is an NSAID. Naproxen is an example of what? It is formulated as what? Delayed as enteric coated what? Tablet. Are we together? Are we together? Are we together? Yes. So, of course, I'm giving you an example of of a compressed what? Tablet, right? Paracetamol, right? Good. Then for multiple release, ofenadrine, yes. For multiple release, ofenadrine citrate. Ofenadrine what?
Citrate.
Citrate. It's an example of what? Multiple release what? Multiple release what? Tablet. Ofenadrine what? Citrate. Ofenadrine citrate is an example of drug formulated as what? This is a drugs. This is an active ingredient, okay? Ofenadrine citrate is a drug that formulated as what? Multiple compressed or tablet. Then naproxen is an example of what? Delayed formulated as what? Delayed release what? You can find many other examples, okay? Yes.
Those tablets that you take once a day, are they under delay release?
No. Those ones are dependent. Can be prolonged, extended, sustained. Okay. Delayed is different. There is that you delay the release in the stomach. For example, you extended the time or you prolong the time. Am I competing? They're not the same thing. Okay. Now that means for extended, it will start releasing consistently for the rest of the day, for like 24 hours. That what by prolonged. But delayed is that you instead of releasing at this time, you delay it, let it pass through and be released so time. Do you now understand the difference between them? Good. Now, the next one for our repeat action. Are we together? Yes. Good. For our repeat action, we have dexclofeniramine. Dexclofeniramine. Of course, you are familiar with chlorpheniramine, right? This is what? Piriton, right? Anti-allergy, right? Piriton. The one you call Piriton. Is what? Piriton. The one is antihistamine that if you can make it to be drowsy. Two of us, small tablets like that. Two of us, good. Yeah, it's for allergy. Are we together? But it can be drowsy. I don't want to go into pharmacology. This is what purely what. This is what dispensing. Let's not go into what pharmacology. I'm trying my best not to go into what pharmacology, because if you go into pharmacology, it's a different not together. So this is the name. That's what chlorpheniramine is formulated as what? It's actually dexclofeniramine maleate. Dexclofeniramine what? Maleate. It's an example of what? Drug and formulated as what? Repeat what? Action. This one is what?
Delayed. No, multiple compressed tablet.
This one is what?
Delayed release tablet.
This one is what?
Repeat action tablet.
This one is what?
Paracetamol. Compressed tablet.
Examples. Okay. So don't say I did not give you any example. Alright, let's continue. Let's continue. Now, the next one is sugar what? Coated tablet. You are familiar with this one, right? Sugar, you are multivitamin, right? Right? You are multivitamin, right? Sugar coated what? Tablets. Here, why do you use sugar coat? Example, why do you sugar coat? Give me one is why you should sugar coat. To mask the what? So after production, after tableting, they will now coat it with what? Sugar what? Materials. Are we together? Yes. So that's what happens in what? Sugar coating. That's what happens in what? Sugar coating. Alright, so now let's continue. So the sugar coated tablet, they are prepared what? Where the drugs have unacceptable what? Properties like the what? Taste, odor, what else? Even color. I hear that the color of the drug can make you not even take it through us.
Yeah,
Maybe dull, you know. So So it's just to mask some properties of the what, like taste, odor, color. So in sugar-coated tablet, the sugar solution are what? Used to coat the what? Tablet. You use sugar solution to do what? Coat the what? Tablet. In the coating pan. You mix the sugar solution separate. After tableting, you now send it to the what? Coating section. They will use the pan with double dating. They will pour the what is it called? The already mixed sugar what? Solution. And as the thing is turning, it will be what? Coating the what? Tablets. Okay? Yes. So when it is completely coated, you pour it away and put the what? Again, at the solution again, and also the what? The compressed what? Tablet, and continue the next what? Batch or what have you. So this sugar coating, apart from the taste, it makes it to have a what? Glossy what? Appearance. It makes the tablet to have what? Glossy what? Appearance. So the idea is to increase what? Patient compliance. The idea is to increase what? Patient compliance, either by test or by what? Looking at it. Am I completing? Who among you have seen multivitamin that is glittering, right? Dark brown. Very, if you look at it in the core, it's inviting. True of us, because it's glittering, it's shining, it's well coated. Okay, so it's for acceptability of the what? Patient. So an example, I've mentioned multivitamin here, right?
Yes.
So I think that one is practical. When I was in manufacturing outlets, I did that one first hand, so that one is practical. So let's not go far. So the next one is film coated tablets. Film. This is called film.
Yes.
Is film what? Coated tablet. Film. Have you noticed that some tablets, have you seen this different paracetamol tablet? That paracetamol tablet you will get, if you look at it, just touch it, you see dust. True of us.
Yes.
On their own, they are not even attractive. But that's what you will see. They will shine.
Yes.
Pure white and shining, they're not dull. You won't see any dust pattern. True of us. That one is film coated. Is what? Is film what? Coated. Is film coated. Alright, let's continue this. Okay, now, apart from looking attractive, it adds to the mechanical strength of the what? Tablet. The one that is uncoated can easily, by handling, chipping, and transportation, may start breaking. But the one that you think coated is together is what? Stronger than the one that is not what? Coated. So apart from the aesthetic value, when I say aesthetic value, I mean the beauty, the elegance, the inviting property, the wanting to take medicine, features you see in the what? Tablet. It also adds to its what? Strength. It helps to withstand, handling is a different thing. You see people lining up, those people that when the trailer or when the truck that have cartons of this medicine come down, maybe to the distributor, they hire all these people that throw cartons. They just throwing that throwing basketball. That thing you are throwing up and down. If the tablet is not strong, it will do what? So film coating also helps you to do what? To be what? Strong. Apart from aesthetic value, it tells the tablet to be what? Strong. Alright, so let's see what we have here. This one, I think I mentioned it, that it provides more strength to the what? Tablet. And film coating is an alternative to what? Sugar coating. Film coating is an alternative to what? Sugar coating. For a patient that is diabetic, do you think it's good to be using sugar-coated tablets?
No.
This is what common sense will tell you, three of us. So let's also not go into what. Let's continue. Let's limit ourselves to what we are doing. Now, so examples of materials used as for film coating are as follows. They are mainly polymers. Polymers like hydroxypropyl cellulose, hydroxypropyl cellulose, hydroxypropyl cellulose, HPC. Hydroxy what? Propyl. They are polymers. Hydroxypropyl cellulose. You also have materials used in film coating. The one used in sugar coating is purely what? Sugar, right?
Yeah.
But the one for film coating is what we're talking about. So another one is hydroxypropyl methyl cellulose. Hydroxypropyl methyl cellulose. Hydroxypropyl methyl cellulose. Hydroxypropyl methyl cellulose. Okay now. Thank you. I like that. That should be a following.
Yes.
Hydroxypropyl methyl cellulose. H what?
HPMC.
PM what?
C.
Are you sure?
Yes, sir.
Hydroxypropyl methyl cellulose. You also have ethyl cellulose. You also have what? Ethyl cellulose. Ethyl. You can write that one now.
Yes,
Ethyl what? Cellulose. So they are materials commonly used for what? Film coating. The film coating is faster than what? Sugar coating. A lot of processes are involved in sugar coating. But film coating, by the time we enter, we go into coating. You understand it better, okay? Because we are going to dismantle coating. We are going to actually treat coating very well. So when we get there, you understand why the film coating is faster than what?
The sugar
Coating. Now the next tablet is what? Chewable tablet. Okay, an example of this is what? Diclofenac. Diclofenac or diclofenac. Diclofenac is an NSAID for what? For what? Pains, right? And inflammation. Pain is an anti-inflammatory. It's an NSAID that's good. Sorry, I'm going to pharmacology. Just take it like this. Is what? Diclofenac, okay? You're different from it's a group of drug that release pain. We call NSAIDs. Is an analgesic. It's belong to this group. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. So, the same thing with this naples there.
Steroidal.
Non-steroidal. Non-steroidal anti-inflammatory drugs. It's a group of, we call them non-steroidal, like ibuprofen, diclofenac, naproxen, and what have you. Are we together?
Yes,
They are in this group. We call them non-steroidal anti-inflammatory drugs. Let us not talk too much on that. So let's look at chewable tablets. You are used to this one, right? You are used to what? This one. They are prepared in such a way that you can actually do what? Chew them. most of the antihelminthics, albendazole is like that. True of us, albendazole, you can just get it and chew. There are many of them. There we also have chewable what? Vitamin C. We also have chewable what? Vitamin C. Now, so chewable tablets, they are chewed in the mouth for their what? Effect. Before what? Swallowing. Let me ask you a question. Do you think it's good to say that you formulated a tablet as chewable tablets and it's bitter? No. People will not buy it from you. Two of us. So once you say that this tablet is chewable, the first thing that will come to the patient mind is that this drug is delicious. Two of us. Yes, you can actually do what? Enjoy it. That means you have desire, you are formulated in such a way that you have masked anything bitter or that the drug itself is not even bitter. Am I communicating?
Yes.
That's the message you pass across. Once you formulate a tablet and pack it and write chewable, that is the first message that will come to this one is not what? Bitter. So on that note, I would say that is the tablets should actually what? Not have a what? Bitter what? Test. It should not have a bitter what? Test to avoid patient incompliance. Incompliance is that if they prescribe it for a patient, he will not take it. And anywhere he sees that tablet, he will tell you, don't buy the tablet. It's bitter. Don't mind them. They say it's chewable, but it's bitter. Antacids are like that. Two of us. Antacid tablets. I've never seen an antacid tablet that is bitter. I say tablets. I've never seen antacid tablet that is bitter. I've never seen. In fact, I've not even seen a chewable tablet. I've not seen a chewable tablet that is what? Bitter. It may not be that chewable. I've not seen. See, it may not be sweet. It may not be what? Sweet. But bitter. I've not seen the one that is bitter. Chewable. The taste may not be that biteable, but it's not bitter. I've not seen one that is bitter. I am yet to see. It may be, I don't know. You can never know everything. You can never know all the formulation in the whole world. It's not possible. Two of us, even as we speak now, companies are formulating new what? New medicine. Two of us, they are designing new dosage forms. So you cannot stand up and say that you know all of them. But the one I have seen, I have never seen. In my how many years of practice? In my what is that? I left school in 2011. So from 2011 to now is how many years old?
30 years.
A child born in 2011 is how many years old now?
30 years.
My 30 years of practice. From internship, youth service, and active practice. I've never seen a tablet that is what? A chewable that is what? Bitter. I'm not saying that it does not exist. I have not seen. I am yet to see. Alright, let's continue. So these are what? Chewable. I think I mentioned some examples, right? Even you are anti-helminthics, right? Anti or helminthic. I mentioned anti-helminthics are. What are helminthics? What are helminthics? Helminthics, what class of organism are they? Hey! What class of organisms are helminthics? Worms now. True of us. Roundworm. Many of them. No, earthworm is an enemy. Okunu Colombia. and how much are in a biology? Right, so what am I saying? That someone said Ascaris. Okay. You said Ascaris. Ascaris lumbricoides.
Yes.
Good. That's what round one, right? Good. Now, helminthics worm. So when you hear anti-helminthics, drugs called anti-helminthic, what are they? Drugs for what? Worms. And I mentioned albendazole. We also have mebendazole. You are helminthics or helminthics. So when you hear anti is what? They are drugs that used to fight what? Worm. And I mentioned mebendazole, albendazole, even your pyrantel pamoids. Pyrantel what? Pyrantel pamoids. They are what? Anti-what? Helminthic drugs. We also have pyrantel what? Embonates. Let's not go there. But that's your combatrin. But even though combatrin is not that, it's not like common again now. But just you chew them, right?
Yes.
You chew albendazole, you chew mebendazole. So there's that, and then we have vitamin C chewable, right? Then you are your antacid. You are jealous. The popular one is what? You are jealous. Avomine. Do you chew avomine? What is the active ingredient in avomine? Let me know. Now that we are not. See, remember I told you that the way you see medicine now should be different from the way others see. Now tell me. You said avomine now. Did you bother to find out the active ingredient in avomine? Who said that? God bless you. Okay, no, sir. Avomine is what? Promethazine. That's the active ingredient. The avomine is just the brand name given to the what? Products. Okay? The medicine. The company gave it avomine as their own brand name. You will still do, I think that should be your second year from pharmacology. You do brand names of drug nomenclature, brand name, chemical name, generic what name. You get to know all these things. So avomine is what? Promethazine. Promethazine. How many milligram tablets? It's not true. It's not true. God bless you. Yes. See, hello. Listen. Someone said all brows here. Now listen. Knowledge. There are two sources of knowledge, okay? The one you have in your what? Brain. And the one knowing something is of two distinct. Knowing it inside your brain and knowing where to get it within seconds. It matters a lot, okay? Yes. Knowing it in your brain and knowing where to get the information within seconds, that makes you a knowledgeable person. You may just be with a patient, within few seconds, you know exactly where to go and get the answer immediately. Someone will call you on phone. Chinwe, I don't know. Maybe the person is aware that you are a pharmacist. Please, I want to do this thing that after Nasamo, you see my headache, my leg is. Which kind of drug will I be able to? You know exactly what to do. You don't say, I don't know. You don't just give me. Don't be shy. Don't be shy. Don't say they will say, I don't know. No. You look it up. If it's not in your head, you know where to do what.
Yes.
In fact, the one said that evil source, I even prefer it to. But the one I have in your brain may be error. No. Nobody perfect. Hope you know. Nobody is what? Perfect. The one you have in head may be what? Yes. It may be mistake. Sometimes human brain fires. Yes, sometimes human brain does what? Fires. If I'm with you, if I approach you to get maybe to ask you something and you are busy trying to, I'll prefer you. I'll say, please, sir, can you look it up? Please look it up. Because I know that one you could and look up is better. Because you may, out of arrogance, tell me so that I will know that you know it. And you tell me nonsense. It happens. It happens. So that's why sometimes I want to teach you how to look up something. It's not that there's nothing wrong there. The only place you don't do that is in here. Example. That one is what? Wrong. Because you are giving opportunity to do what? Study it. True of us. But that one that someone just come to you, bam, unprepared. Sometimes you don't say it. Look it up. Yes. Yes, if you know it, wonderful. But if you are not so sure, don't be arrogant. Look it up. Because it's what? Spontaneous. It's impromptu. If it's not clear in your head, look it up immediately. But in your exam, you have been given the opportunity to do what? Study. That's why doing that in exam hall is wrong. It's not even, it's a crime. Hope you know.
No.
You don't know?
No, sir.
Exam malpractice. Exam malpractice. Exam malpractice.
Yes.
Has jail term. Are you aware?
Yes.
Jail term. Are you aware? Hi. They play. You don't know? So so that she looked it up immediately and said the answer. Hello, are we together? Yes. That she looked it up immediately and gave me the answer. I like it. I like it. And believe you me, do you know now that she looked it up and tell me the answer? Call her next 20 years. Call her. No, it's not possible. No, listen. It's not possible. It's not possible. This is the power of research. Hello? This is the power of what? Research. So far she picked her phone, look it up herself. So I want you to understand. Let's come back to what we are discussing. Alright, so that's for what? Chewable what? Tablets. So we are done with tablets ingested what? Orally. Now let's look at tablets. Let's look at tablets using the words oral or buccal cavity. Oral or what? Buccal or oral or what? Cavity. Let's look at the tablet using what? Buccal or oral tablet cavity. This one is simple. The medicine is what? The tablet is placed where? In the cheek pouch, or in between the cheek and the what? Teeth. Where is your cheek pouch? Here inside, right? Place it in the cheek pouch. Cheek pouch. In between the cheek and the what? Teeth. So, an example of this, we have fentanyl. Fentanyl is an example of buccal cavity. Who said that one? Hey! Do you know that by virtue of telling me buccal cavity, that means only water there and say if we put that buccal cavity, only water there here equivalent. Buccal what? Tablet, okay? Buccal tablet. Fentanyl. Fentanyl is formulated as what? Buccal tablet. Buccal what? Tablet. Okay. Now let's look at sublingual. Sublingual tablet. Sublingual.
Is it
under tablet is oral?
Sublingual is under tablet used where? In the oral what? Cavity. So sublingual tablets. Sublingual tablets. Sublingual tablets. These ones, they are formulated as candy. You know what candy is?
Yes.
Candy, right?
Yes, sir.
Candy. So formulated as candy, and they are used where? Sublingual is where? Can you hear?
Under the tongue.
You're hungry. They are used where?
Under the tongue.
Sublingual below where? The tongue. Sublingual below the what? The tongue. They are placed below the what? The tongue. They are placed below the what? Tongue. For fast what? Release. In your AUM, have you been have you done? I said 40s at the same time. True of us. I said 40s at the same time. Okay, in your AUM, this second semester, have you done something on first pass metabolism? Okay, we can. So you just started. There's what is called first pass. You know, most of the things you put in your mouth, be it food, things you put in your mouth, be it food, be it drug, must pass through. They pass through your liver. They pass through their liver. Yes. So there are some drugs that when they pass through, that first time they pass through liver, they get destroyed. Okay? So that effect of destruction or degradation or this drug experienced in passing through the liver is what is called the first pass effect. First pass effect. First pass effect. Now, so to avoid this first pass effect, some drugs are formulated as what? Sublingual tablet. So they don't have any business entering the what? The liver. They put it in the mouth. From the mouth, they would what? Disintegrate, dissolve, and they enter the bloodstream straight without passing through the what? But once they enter the stomach, they are bound to enter the what? Liver. So to avoid first pass effects, actually first pass metabolism is that when they pass through, they will metabolize in the what? Liver. Before they even start their action, they will not be able to do anything. So they are not all drugs anyway. So drugs that are affected by this first pass, this metabolism is called first pass effect with respect to the drug. We call it first pass. Ngafe in keys. First what? Pass. Ngafe in keys is in Igbo language. Ngafe in keys is in Hana Ngafe in Ebe. Umeju believe okay? So Ngafe in keys is Hana Ngafe in Umeju madu. Agafe is here. As they pass, they will be affected. They will be destroyed, and they will not be there to do their own. So to avoid that, some drugs are formulated to be used sublingually, because around here we have a lot of capillaries through of water. Once you can enter the bloodstream from there. So that's what happens in what? Sublingual tablets. So for sublingual tablet, these tablets are placed below the tongue for fast release. Number one. For fast release. And number two, for what? To avoid what? First pass effects. To avoid first pass effects. Someone, when you do it, you will appreciate this. Okay?
Okay,
You will appreciate it when you do it. You will appreciate it. Yes. What's that? Don't worry, you see it. So an example of such drug is nitroglycerin. Nitroglycerin is an antihypertensive. Let me not go there. Just nitro what?
Glycerin.
Nitroglycerin. Glycerin. An example of drugs formulated as sublingual tablet is what? Nitroglycerin. And I'm a examples. I know why I'm saying this. You will explain that no evidence. Huh? You feel the pain? Okay. Isn't it formulated like that for that? Or people are just using it for that? Is it formulated? Because you can also Prophos. Yes, but for the formulation, is it really formulated like that? Find out and get back to me. So someone mentioned nifedipine. Hello? Someone mentioned what? Nifedipine. For nifedipine for fast action. They place under the tongue for patient that is it in emergency case?
Yes.
Are you sure?
Yes.
Is it emergency case that they put the pin under the tongue? It's for fast action now. It's not for fast action. So let's continue. So the next one is, let's look at lozenges. Number 3, trouches or lozenges. Trouches or lozenges. Yes. Trouches or what? Lozenges. Here we see you are diquanilum, blah blah blah. The one you call what? The one you call what? You have your strepsil, right?
Yes, sir.
Strepsil is there, right? Strepsil, right? Diquadin, I don't know. Who has seen Diquadin before? It's a brand name. Okay, oh yeah, check it up now. Check it up now. Check. Oh yeah, now check it up fast. It's a brand name. Have you seen it? I'm all right. We are. Is here. I will not write this one. Oh, yeah. Check it. It's a brand name. Okay, tell me, what does it contain? Yeah, what does it contain? Have you seen it? Have you seen it? Do you know what? That's the what? Apple bigot, right? Okay, spell it for us. Spell the for us. No, the brand name is what? Diquadin, right? Then what is it contain? It contains diquanilum what? Chloride. For what? For what? Where is it used? Sore throat, right? Sore throat. That's why you take it as what? Lozenges. You lick it, right?
Yeah.
It will clear the sore.
Sure.
Does it make sense to you now?
Yes,
It
sir.
contains diquanilum what? Chloride. But the brand name is what? Diquan. It's there in the pharmacy. Scatter the pharmacy. It's not a new. It's check what the dosage from. Is it lozenges? So it's under what? Lozenge. Even your strepsil for sore throat, right?
Yes,
You are familiar with that one, right? Strepsil now. For sore throat now. They are sweet, right?
Yes.
Like candy, right? You lick it. As you lick it, you gradually clear the what? Infection, right? So that's what we mean by what? Are we together? That's what we mean by what? Troches or what? Lozenges. They are candy-like tablets. They are candy-like tablets that are used for local action of the what? Draw. There are also cough lozenges. There are some cough syrup that are in form of what? They form it as what? Lozenges. There are cough syrups that the active ingredient in that syrup are formulated as what? Lozenges. There are many of them. So here we have many of them. We have clotrimazole troches. Out together. We have clotrimazole troches. We also have nystatin lozenges. Nystatin what? Lozenge plus 3 I've mentioned, 2 I've mentioned, right? 2 I've mentioned. We also have nystatin lozenges. We also have menthol lozenges. Okay. Yes, I agree with you. So now, that's for what? Lozenges. Excuse me. All right, so even you have Vicks, right? Vicks Lemon Plus. Hope you know. Yes. Are you aware? Yes. Are you aware? Yes. Vicks, are you aware? That is not just sweet. Hope you know. Yes. You don't know what is that. You don't know what? Okay, you've not seen Vicks before. Look it up. No, look it up. That's why you're here. You're here to know. No. Why did you pay your school fees? To know about She said that she don't know this I'm talking about. Yeah, that's why you are here. If not, I won't be here now, right? Yes. So you have not committed any crime. I don't know you. That's why you are here. So all you need to do is this: if there's anyone I mentioned, you can on your own go back, you can put it down, go back and do what? Do more research on that and make up your notes. Get more examples. That's how to do. Yes, that's how to do. It's not magic. You know, knowledge is like a drop of water from that enter a bucket. That's how knowledge grows. If you drop a bucket here, you are making noise. You are discussing my class. If you keep a bucket here, and the drop of water comes from this stream, before evening, it will what? That's how knowledge is. You pick it. Before you know what's going on, you look back and ask yourself, when did I learn all these things? Because you are consistently picking it small. We mentioned 1 or 2 things today. You put it down, go back. Before you read or sleep, go through, browse it, check it up, write it in your notes. Before the end of the semester, if you see what you accumulated, in fact, your notes you should have up to 3 different pens in your notes. Different colors. You should have black pen, red pen, blue pen in your notes. Each of them designates something. You can use your blue pen. Normal lecture, when lecturer is in class, what lecturer is saying, use your blue pen to do what? You look up something online, use your red pen to do what? Write it around that same area, same part of the book. You wrote what lecturer said. Align them. You can use black pen maybe for your own, as you are studying now, you are not studying, maybe you have your material given to you by a lecturer. You are going through it. Your own thoughts, because as you are studying that thing, you develop your own thought. True of us, your own thought to develop. You can use it a different color. If you consistently do that, by the time you now get that to your note and read, it may look funny to people, but you are the one that knows what you did in your note. That note is a weapon of mass destruction. If you open it, you go through it. When you start talking, people will be like, where is this one coming from? It's not magic. And what you brand somewhere and put down, anytime you open it, you remember it. You remember the day you browse that thing. And before exam, you just what all you do, just go into your material is because you have, if you remember everything that happened that day, okay, you shift it. So take this thing I gave you now for free. I gave it to you for free. People pay for this. Take it seriously. Now let's continue. So the next one is what? Dental code. Though this one, those in the dental therapy school, that one that will appreciate this one more. Okay?
Yes, sir.
Dental code. What are dental code? Dental cone and tablet are what? Prepared to be placed where? In the dental what? Cavities. Okay? Dental cavities. What are they used for? They are generally used to do what? Avoid microbial attack in the what? Teeth. Okay? They are generally used to avoid what? Microbial attack in the what? Teeth. So it's also a tablet. Here we have collagen. Collagen can also be formulated as what? Dental code. Collagen is also formulated as what? Dental what? Cone. Dental what? Cone. Okay, now let's go to the next one. Are we together? Yes. Good. Let's go to the next one. Tablets administered by what? Other what? Roots. Okay? Did you check whether it's route or root? Who checked? Roots. It's not route. So the first one here we consider here is what? Implant tablets. Implantation what? Tablet. The one that used for what? Implant, as implants. Most of the hormonal drugs, some of these contraceptives are used as what? Implant. Okay? This one, they formulated it that to show you that they are do what? They are implanted in body cavities. For what? Prolonged what? Effect. Okay? Over what? Like how long? So someone said 1 year. Is it true? You know, it can be up to 1 year. Yes. What are gifts? As the thing discussing, and they're laughing in my class. If you notice that you are switching off, get up and do what? The class. Don't stay here and be gisting. It's wrong. It's very, very wrong. Okay, so I said that the tablets are implanted in what? The body cavities for prolonged what? Effects from several days to months up to what? A year. The tablets are what? Small in size and they are what? Cylindrical, okay? Small in size and what? Cylindrical. So most hormonal drugs are formulated as what? Implants. Are formulated as what? Implants. They are those used in what? As contraceptives. An example of here is we have estradiol. Good. Estradiol is an example of drug formulated as what? Implant. Estradiol. Is extra what? Estradiol. Estradiol. Estradiol is the hormonal drug that is formulated as what? It can be formulated as what? Implants. Implant. The other one is what? Vagina tablets. Vagina tablets. We will still do suppositories and pessaries. That's the last topic in this course. Suppository and the pessary. Then you understand this vagina tablet. So tablets, most of you must have used it, okay?
Yes.
Most of you must have used this word. vaginal. Some say that they are treating toilet infection. Is there easier to like toilet infection?
No, vagina is like that.
Some of you cause it yourself without even knowing. Excess antibiotic. So we say, because you had sex, you go and take antibiotic, anti-cross. You are pumping your system with what? Antibiotic. And the normal flora in the vaginal area that should protect it. It's I said something about normal flora, right? They will be affected. And when this normal bacterial flora that should take care of, I'm just talking now, you are discussing. When they will, instead of this, can you keep quiet? Can you keep quiet? And just something very important now, you are just tomorrow you say you have toilet infection. It doesn't that you caused it. You know they say with antibiotics, say that you are treating small antibiotics and because you at the end there, the normal flora that should give your vagina good health and protect it, you go and deal with it with antibiotic. And once they go down, fungal infection will do what? Come up. We call it supra infection. They will come up. You see yourself developing fungal infection. Without knowing that you caused it by wrong attitude. So please, know how you use anything antibiotic, both the one you use to wash and the one you take. Be careful. That place doesn't need unnecessary antibiotic. Yes, if it's clear that you have infection, we have bacterial infection, that one is there. If you've gone for tests and it's clear that it's there, it's a different thing. You treat it, but don't even prolong it, because if you prolong use, it will start affecting the what? Normal flora. Bacterial flora that will protect it, and the fungal infection will come up. You see yourself developing fungal infection, and you call it toilet infection. So, these vaginal tablets, some drugs are formulated as vaginal tablets to treat for local action in the vagina. Local action. You know, drugs can be used for systemic effect. Drugs that can also be used for what? Local effects. Are we together?
Yes, sir.
Good. If you take drugs and it will disintegrate, enter the bloodstream, take it. If you have headache here, if you have headache in your head, and you go and take paracetamol, that will enter your stomach. What concerns paracetamol in the stomach and your headache? Is because it has systemic what? Effect. It will enter your bloodstream and get to those places. That's what we call systemic effect. But if there's anything like that anyway, you want to treat locally, if you want to treat locally, that means you cut your hair and get the paracetamol and rub in your head. It's for local what? Effect. Are we together? Yes. So for the vaginal tablet, you put it in vagina for local what? Effect in that vaginal area. Are we together?
Yes, sir.
And even though there are some you take, for those that have fungal infections, like candida, you see them, they give you the one, maybe fluconazole, 1 milligram you will take weekly.
Yes, sir.
You will take. That one you are taking in your mouth that will enter your system is for systemic. So you treat it systemic. At the same time, they give you the cream you will rub, or the tablets you do what inside. That one is for local. So you are treating locally and what? Does it make sense? Do you understand what we mean by what? Systemic effect and local what? Effect. So that's exactly what we are talking about here. We say that. Excuse me.
Yes, sir.
I don't like this. So, sorry for the distraction. These people are distracted. Sorry for that. So now, let's continue from where we stopped. I said that the vaginal tablets, these tablets are incorporated in vaginal what? Cavity. To do what? Prevent what? Or treat what? Infections. So the dissolution of and the release of drug is what? Slow. It will enter there, slowly dissolve. The dissolution will take place slowly and release the antigen that will act locally in that place. Am I communicating? So that's what happens in what? Vaginal tablets. Here we have your clotrimazole vaginal tablet, right? Brand name of clotrimazole vaginal tablet. You know. Huh? Hey. Clotrimazole, eh? Mazul. What's not Mazul? Gynamate. God bless you. Gynamate. Yes. It's a brand name. It's clotrimazole. It's antifungal, right?
Yes, sir.
Clotrimazole. Clotrimazole is antifungal. We also have it as tablet, vegetable tablet, even as cream, right? So there are many of them. So let's go to the next one.
So you think that antifungal
Drug now. Is that antifungal drug now? Yeah. For fungal infections. For treatment of fungal infections, okay?
What can be candida?
Gynamate. Candida is a fungi. Candida albicans is a fungi that causes candidiasis. Please, this is not AUM plus. It's not painkiller. This is dispensing. I don't want to go deep into that. All right, let's continue. Please. Let's continue now. So now let's go to the other category. The tablet used to prepare what? Solution. Tablet used to prepare what? Solution. Now we have your what? Effervescent tablets. Maybe we're talking about effervescent things. This is your effervescent what? Tablet. Effervescent what? Tablet. They are dispersed or dissolved in what? Water, right? Before what? Use. True of us. Depending if they are soluble in water, they are dissolved. If they are not, they are what? Put it in water and they bubble. Ooh, right? Example of tablet like that. Is it tablet?
Okay, tablet.
Yeah. Yeah. Cashew. CAC 1000, right? Yeah. By Sandoz, I think so. CAC 1000 is an effervescent tablet. Put it in water, bubble, it will dissolve. You now do what? Drink it. Is this sweet? Yeah. There are drugs like that. So what happens is that, listen carefully. The tablets are dispersed in water to produce solution of what? Hello? They are dispersed in dissolved water to produce a what? Suspension of what? Solution. Okay? Yes. Okay, no. We have dispersed tablets, but they are not effervescent anymore. So we have artemether lumefantrine tablet that is dispersible, right? But they are not effervescent. So what happens is that the tablets are dispersed or dissolved in water to produce what? Suspension or what? Solution with the release of what? Carbon dioxide before what? Administration. The tablets are generally used for what? Carminative effects, to expel gases from the what? GIT. To expel gases from the what? GIT. There are different uses, okay? Like that for CAC 1000. It's for strong glue, right? And what? Oh, say these are we together? So under this tablet used to prepare solution, under effervescent tablets, you have your what? There's also ranitidine. Ranitidine is also can also be formulated as what? Effervescent tablet. Ranitidine is an anti-ulcer. Anti-ulcer. Ranitidine is an anti-ulcer drug. It's used to treatment of what? Ulcer. Ranitidine. Ranitidine. Are we together?
Yes.
And I don't do it. It's an anti-ulcer used for treatment of what?
Ulcer.
So it can also be formulated as what? Effervescent what? Tablets. It can also be formulated as what?
Effervescent tablets.
So let's look at dispensing tablets. Dispensing what? Tablets.
Sir, can you call effervescent tablets carbon tablets?
Carbon? No.
Why so it's involved?
Carbon tablets. And maybe by virtue of the fact that they produce what? Carbon dioxide. Maybe they decide to name it like that. So it's not completely wrong. But what is produced, the water it produces is carbonated water. Alright, let's continue. So we have our dispensing what? Tablets. They are almost the same thing with what? Effervescent what? Tablet. Okay? They are almost the same thing with what? Effervescent what? Tablet. But what here now, the most important thing here is that the concentration, listen carefully. They are almost the same thing with effervescent tablet, but what is important here is that the concentration of the drug in the words, in the dispersion, is very, very important, okay? Unlike effervescent, concentration is not of utmost importance, okay? But in this one, the concentration in the final dispersion of solution is what? Very, very what? Important. You must put it into what? Concentration. So that's the difference, but they're almost what? The same thing. In our phone, after pressing phone, she asked me what's the difference. Keep on pressing your phone while I'm teaching. You browse, but you don't press your phone when your answer is what? Teaching is wrong. Okay? Do it at the right time because you'll be confused. You'll be confused. I said that they are almost the same thing with what? Effervescent. The only difference is that the concentration of the drug itself inside the dispersion, what you have already formed, when you disperse it, is of utmost important. You must put it into what? Consideration. That's what I say. Just as the dose of rag powder are of what? Important. True of us.
Yes.
But for gog powder, is the dose that important?
No.
Even though it's necessary, it's good to, but it's not
that
like if you don't do it compared with this one. That's what I mean. So we have the hypodemic tablets. Hypodemic what? Tablets. This one thing about this one is that they must be what? Sterile. Note that point. Okay? One thing with this hypodemic, because of where they want to use it, they must be what? Sterile. Very important. So they are one type of, is there a type of what? Sterile what? Preparation. Sterile what? Preparation. So these tablets are dissolved in water for injection. Water for injection, are they sterile? Is this sterile? Yes. So everything you are going to do, you must do it in a aseptic condition. The tablet itself must be sterile, dissolved in water for injection before injecting. Okay? From the name of hypodemic, once you hear hypodemic, what comes to your mind? So you should what? Injected, right? So that means it's a sterile preparation. Everything that's entering the system must be what? Sterile. So this one must be what? Sterile. So the last but not the least, example. Okay, example of dispensing tablets. Not presents. Sorry, where did I mention not present before?
And delayed.
Are you sure?
Yes.
So under this dispense tablet, you also have naproxen sodium. Just put sodium by the side. Naproxen sodium. Okay? Naproxen. Hope you know the difference between naproxen and naproxen sodium. Naproxen sodium is now a salt, right?
Yes, sir.
True of us. But the naproxen is just the drug itself. It's not a salt of it, right? So know the difference. Very important, okay? That's why you see drug like amoxicillin. You see something like clavulanate. You see something like clavulanate potassium. It's a salt, right? You also see that clavulanic acid. Clavulanic acid. I mentioned this yesterday when I talked about augmentin. When I talked about augmentin, I told you about augmentin yesterday. And it contains amoxicillin and the clavulan. Some brand contain just amoxicillin and clavulanic acid, but some brand contain amoxicillin and clavulanate, potassium clavulanate. Okay, the same thing now. If you see this diclofenac now, can appear as salt. You have diclofenac sodium. You also have diclofenac potassium. These are different sort of it, okay? So that's what I mean by this naproxen what? Sodium. So it can be used as what? As what? Dispensing what? Tablet. So an example of hypodemic tablet is morphine sulfate. Morphine sulfate. Example of what? Hypodemic, okay? Morphine what? Sulfate. Morphine sulfate. Morphine sulfate. Example of what? Back ahead. Back ahead. Yes. I didn't say I said pack it away. Oh, so grab here. Oh yeah, pack it. Since I'll buy scissors. We need it here. Is anybody that has scissors who says she come? Help us with scissors. No, you don't need that. So let's continue. Let's continue. Okay, let's continue, please. Let's continue. Let's not cause distraction, please. Now, the next thing I want to talk about is what? The last on the types of is what? Tablet what? Triturate. Tablet triturate. Remember, we mentioned this in your first semester, right? Yes. Tablet triturate. Here they are triturated in moles, right? Remember, in moles, right? In moles. Are tablet triturate? Are they that strong? No. Are they strong? No. You're not serious. How can you say you don't know? Didn't I give it to you in your mathematics?
You told us last semester that if we come this semester, we'll go deep into it.
Okay, browse it. They're not that. Browse it. Are they strong? Are they strong? Who has seen it? Search it. Tablet triturate. Tablet TT. No. Tetanus, whatever here. Please. Tetanus, whatever it. Tetanus totally different, please. This one is tablet what? Triturate. Trituration from trituration. So tablet triturate. But this one is now in mode, okay? Yes. So what happens is that these are usually prepared by using triturate what? Mode, which are rapidly and almost completely soluble. They are rapidly and almost completely soluble. So they are intermediates, okay? They actually what? Intermediate. Remember I mentioned intermediate, right? Tell me another dosage form that is intermediate. Tell me another dosage form that is an intermediate. Give me an example of another dosage form that is an intermediate. Huh? Someone say something now. I heard something. Again. Granules, thank you. Granules granules is segregated from true or false?
Yeah.
It's also an intermediate, right?
Yeah.
Because it's from red powder to granules. That granules can now be compressed for what? Tablet. True or false? So it's an intermediate. The same way I said that this tablet tartrate is also an what? Intermediate. Because from there you can produce that's why I said that they rapidly and almost completely what? Soluble in what? Water. I don't believe in too long lectures.
Sir, question.
Ask.
This dispensing tablet, can you also call it dispersible tablet?
Dispersible tablets. Dispersible tablets.
You gave us types of tablets last time. One of them is dispersible.
Dispersible tablets. What does about dispensing tablets? No, now what does about dispensing tablets?
Okay, you see that it's similar to FM.
Please listen to this important announcement. If you are waiting your results, please submit your results. Results should be out by now, isn't it? Ejiofor, Adobe, Udoe Marvelous, Akabueze, Betukuvera, Uka for Chine Cherem. Yeah, Chile matter. Stop making noise. Are you listening to what I'm saying? How many of you are in the class? 73? I have only 71 here. If you know your name, you have not submitted your result, the result you came in with. You come to see me in my office after your lecture. Okay? Whether you were admitted by NECO or with Mayen.
So do that immediately after the lecture. Okay, so what I say about
You see that they're similar to FM?
you're making noise. Please. Don't worry, we will soon dismiss, please. I'm taking a quick question from her, please.
Consider that dispensing tablet as similar to FM. Just that the dispensing tablet and the concentration is more important than FM. Give examples.
Okay. I can take it. I can take it. Listen. But you know that, but look at it now. That dispensing tablet, that dispensing, the dispersible is so clear that they are forming suspension. Hope you know. When you hear dispersible tablet, it's so clear that what you form is what? A suspension. But this dispensing, there's no limitation. You can form so. That's why I cannot completely say it is exactly, but it's specific. You know that effervescent suspension can be formed. Solution can also be formed depending on the solubility of the drug. True of course.
Yeah, we see that dispersible tablet is a tablet that is based in water. Whatever it is, aspirin. It's an available dispersible tablet that can dissolve in water before
It's not dissolve. That's the wrong. You can't say dissolve. It's not dissolve. Yeah, it's not dissolve. It's dispersed. See, most of these things is listen. Sorry to say it, but please, some of these things, I'm speaking to you now pharmaceutically. I'm speaking now pharmaceutically. Dispersion is different from dissolution. In dissolution, you are dissolving to form a solution. In dispersion, you are dispersing to form what? Suspension. So far, it's solid in water. If you are dispersing to form suspension, not solution. So please, these words, most write-ups interchange them without even knowing. So some of these things you see online may not, they just change it. It's not exactly the same thing. That's what I'm trying to make, okay?
Yes.
Pharmaceutically, okay? What are you saying? Whether it is integrated or not, it's not. We are talking about what is formed after. I can see the first explanation. Yes. It's okay. Thank you.
Sir, the delayed release tablet.
Please, someone is okay.
The delayed release tablet. They pass through the first pass effect. Is it possible that they don't break down? Because is it that any tablet
They will break down. The alkaline medium. You know they are formulated they are formulated to be in the form that alkaline medium can help them to do what? They will see breakdown in the alkaline medium of the intestine, not the stomach now. Does it make sense? You know, stomach is acidic. But the pH increases towards the what? Intestine. Unlike the what? Stomach. It will enter your I see that enter your stomach. Does it enter your stomach? It will get there now. Hey! Check it out. Check it out. No, I like what she's doing, but see, I keep saying this. It's not every question you can ask. There are standard questions you can simply do what? Check it out. Does this thing undergo first part answer one me? But if it's something that needs explanation, something you need to be so you understand this, I can explain, but just asking me, sir, how many types of tablet do we have? Hey, brother, get more now. Or sir, what is an agency? You are sitting down in this class and you have your food, man. It's another question you can easily look up. I think what. I can't hear you. Speak out.
We have water.
Cardiac arrest. I've not seen. Okay, there may be, but I've not seen. But I know that we mentioned antihypertensive, right? Like nitroglycerin. Nitroglycerin helps in the blood flow. That's.
Is there more tablet?
Yes, it's for sublingual. Nitroglycerin is for. Yes, but cardiac arrest. What? That is nitroglycerin. It's not nifedipine. Nifedipine is directly what? Hypertension. Yes, nitroglycerin. Yes. That's what they use. Yes. That's good. I like that. All right. So please, I think we'll stop here.
Yes, sir.
We'll stop here.
Okay, sir.
So where in our outline we've treated definition, advantage, what else?
Types of tablets.
So where are we starting the 99? So we go over to tablet what? So tomorrow we go over to what? Is it tomorrow or by? Ndị actually go out. So you know to come by 10:30. Okay, today is Tuesday, right? Sorry. Sorry, we'll come tomorrow. We'll come tomorrow, okay? Tomorrow we'll start with tablets or ingredients, okay? You are making noise. Your lecturer just enter and you're just making noise. You can smile and be happy without making noise. It's possible. Please stop disturbing others. All right, thank you very much for your attention. See you tomorrow. God bless you.